Hello, and welcome to this week's flashcard presentation on pelvic inflammatory disease. So, pelvic inflammatory disease is an infection that affects the female reproductive organs, including the uterus, fallopian tubes, and ovaries. It typically occurs when sexually transmitted bacteria spread from the vagina to these upper reproductive organs. Approximately 15% of untreated chlamydial infections progress to PID. Delayed diagnosis contributes to inflammatory sequelae, including infertility, ectopic pregnancy, and chronic pelvic pain. Approximately 1 in 6 women with salpingitis develops infertility. The cost of having PID has been estimated at $2,000 per patient, and 4.4% of women in the United States have reported a history of pelvic inflammatory disease. So the pathophysiology of pelvic inflammatory disease begins with an infection in the lower genital tract in females. The infection can be located in the vagina or cervix. The infection can ascend to migrate to the upper reproductive tract, causing the pelvic inflammatory disease. The upper reproductive tract includes the endometrium, the fallopian tubes, ovaries, and peritoneal cavity, because there is an opening in females between the peritoneal cavity and the GU tract. The most common infectious agents causing PID are chlamydia and gonorrhea that enter through the vagina and ascend to the cervix, but there are also other microbes that can lead to PID as well, including E. coli and mycoplasma. When a person has unprotected sex, sex with multiple partners, or a history of STIs, or an imbalance of vaginal flora, there is an increased risk for developing an STI, which then leads to the pelvic inflammatory disease if left untreated. Another risk factor is IUDs, because they can act as a mechanism for bacterial ascension in the urogenital tract, leading to PID. And the PID develops when the bacterial infection in the vagina or cervix leads to inflammation in the mucosal layer that lines the structure. The vaginal flora becomes imbalanced, leading to a vaginosis, and the infection travels through the reproductive tract because when the vaginal pH is imbalanced, the cervical mucus can become less effective in creating a protective barrier. And when the bacteria reaches the fallopian tubes or ovaries, it can create inflammation, which is also called a salpingitis or a salpingo-oophorytis, which is when the ovaries become inflamed. The body's immune system is activated by increasing its white blood cells to the area, therefore creating damage to the epithelium lining, creating scarring and adhesions, which can lead to complications such as infertility if left untreated. And if left untreated for long enough, other complications can occur, such as abscess. So some risk factors for pelvic inflammatory disease consist of an age younger than 25. Generally speaking, women between the age of 15 and 24 that are sexually active are diagnosed with PID. Having new or multiple sexual partners, which can imbalance the pH or expose the female to an STI. Unprotected sexual intercourse, intercourse with a symptomatic or asymptomatic partner, because being asymptomatic can still lead to transmission of the STI. Young age of onset of sexual activity, younger than 15, and also a history of STIs or a history of PID also increases the risk for reinfection. And also use of non-barrier contraception, especially IUDs, because the IUD can be a mechanism where the bacteria will ascend into the reproductive tract more easily. And also vaginal douching, because that will imbalance the pH, and then the female will be more susceptible to getting the STI. Signs and symptoms include some women being asymptomatic, and other symptoms include pain that can be mild to severe based on the severity of the disease. And the pain can sometimes be in the lower abdomen, or it can be referred to the back. There's unusual or heavy vaginal discharge that may have an unpleasant odor, especially if it's related to an STI, such as bacterial vaginosis or chlamydia or gonorrhea. and unusual bleeding from the vagina, especially during or after sex or between periods. There can be dyspareunia, which is painful sexual intercourse. There can be dysuria, which is painful urination, because the bacteria has inflamed the urogenital tract, and when the acidic urine is coming out, is causing the pain sensation. Also, fever can be present with nausea, vomiting, diarrhea, based on how severe the infection is, especially if there's an abscess that formed in the fallopian tube or near the ovaries. And also, there can be foul-smelling discharge, and on examination, there will be tenderness to palpation of the cervix or the uterus or the ovarian area, which is usually in the lower quadrants of the abdomen. Diagnostics include a pelvic exam where the doctor will find out if you have PID by doing a bimanual examination and testing for tenderness. Also, there would be a vaginal swab that would test for certain STIs, especially chlamydia and gonorrhea, because those are the two most common causes of PID, but there can also be other bacteria that cause the disease, such as E. coli or mycoplasma. Blood tests can be performed, a sexual history and a urine test can also be performed to detect other infections. There can also be a complete blood count, an ESR, a CRP, a C-reactive protein, an endometrial biopsy, or transvaginal sonography to see if there's any abscess that's formed or to see if there's any inflammation of the reproductive tract. And lastly, treatment includes antibiotics. Usually a combination of antibiotics will be prescribed to start immediately, even prophylactically, before the culture comes back based on a clinical physical exam. There's also a recommendation to treat the partner, your sexual partner, to prevent reinfection with an STI, even if they're asymptomatic, because usually there can be an STI present without symptoms. And also recommended is temporary abstinence to avoid sexual intercourse until treatment is fully completed and symptoms have resolved. Several medications can be used depending on which bacteria is present, and it can be individual antibiotics or it can be a combination of several different antibiotics based on the cause. And sometimes hospitalization is required if there's severe PID that's been left untreated for a long time that's caused further damage to the fallopian tubes or the ovaries. And here are my references, and thank you for watching.